Good evening. My name is Regina Reardon. I'm administrator of the UFCW Local 1776 Benefit Funds, and I want to welcome you this evening to our first in a series of two very important webinars about the behavioral health benefit offered through the UFCW Local 1776 and participating employers Health and Welfare Fund. The behavioral health benefit provides a great benefit, great resources, great solutions for those of us who have challenges in everyday life. And as we know, life in 2001 is very, very complicated, but it's complicated even further by the pandemic and all of the pressures, additional pressures that places on us as individuals and our families. So we're very fortunate this evening to be able to focus on the mental health benefit and all of the great resources that are available to you. We have with us to provide us with that all-important information on the benefit and resources, our great strategic partner from Mental Health Consultants, Morgan Terry. Morgan serves as the clinical director at Mental Health Consultants, overseeing specialty workplace behavior and member assistance programs. She's a licensed marriage and family therapist, certified employee assistance professional, and Morgan is qualified to perform DOT substance abuse professional services. She has over 15 years of clinical experience working with individuals and client organizations. And again, she's a tremendous resource that is available to you, not just tonight in this webinar, but in everyday life. Whenever you need assistance, Morgan is there with her colleagues at Mental Health Consultants, as we are at the fund office. So call us if you need us, call Morgan and her colleagues if you need them. Morgan, please fill us in.
Thank you. Thank you so much, Regina. And thank you guys for inviting me here today. I'm really excited to speak with you about your behavioral health benefits. And my goal is to share as much knowledge and education about these benefits so that you and your covered dependents are aware of the services available and how to access support. I'm going to put on my screen share here so that you guys can see the PowerPoint presentation, but I want you to know that throughout the presentation, if you have questions, if you need more information about a topic, you are able to go ahead and use the Q&A feature, and we will be responding to those questions throughout the presentation and take some time at the end as well. So thank you again for joining me here this evening. Like Regina said, I am the clinical director here at Mental Health Consultants. I have been with the company for a combined total of 12 years, and I've worked in a variety of community-based mental health and mental health positions. But I'm most excited to be able to teach and educate and help individuals understand how to get the support that they need. MHC started as a small family-run organization. We've been providing workplace behavioral health services since 1980, and we do this by partnering with organizations such as UFCW Local 1776 and the Participating Employers Health and Welfare Fund to help members overcome challenges that impact both their professional and personal lives. Now, this is a confidential behavioral health benefit that is being offered through this partnership, and it really is multifaceted. We offer a range of clinical services such as resource identification, referral services, case management, and even crisis support services. And tonight, I'm going to talk about all of those services and how you're covered for them in more details. But I want to start by talking to you about why someone might reach out to MHC, why someone might be thinking about utilizing their behavioral health benefit. So there are many reasons why an individual might reach out to use their behavioral health benefit offered through your Health and Welfare Fund and MHC. Some of the top reasons people access support is because trying to balance the demands of work and home life It's really hard, right? We all have increased levels of stress. And like Regina said, 2020 and 2021 has not made that any easier. So maybe you're experiencing increased symptoms of anxiety or depression. Maybe your family is going through some transitions and you want to reach out for either family or couples counseling. Some individuals find themselves struggling with alcohol or substance use and misuse, or you're experiencing a loss or you're grieving the loss of a loved one. These are some of the top reasons why individuals might reach out for support. But regardless of why you're seeking to access your benefits, NHC is really here to help develop a support plan and provide you with resources that meet your needs. And these services can range from outpatient counseling and medication management services to higher levels of clinical care, such as inpatient treatment for psychiatric or substance abuse services. In addition to this, should you or your family member be experiencing a mental health emergency, MHC is always available around the clock to offer support services. And we assist individuals in connecting with emergency services such as inpatient treatment so that crisis can be resolved safely and as quickly as possible. But even after hours and over the weekend, we have a licensed and certified clinician that's going to be answering your calls. Now, in addition to that, we offer some occupational support services too, such as critical incident response services. And these are really services that are offered in the workplace in the case of an emergency that arises there. And they can be in the form of on-site or virtual support through telehealth in the event of any kind of traumatic event that may cause members to experience really strong emotional reactions, right? And these are offered both individually to employees or in group format to really help support the impacted employees and these are typically arranged by your shop steward or your union representative or even your store manager. An example of when this might be used is if there was an act of violence in the workplace or the death of a coworker or a natural or man-made disaster that has occurred. It's one of these services that we hope we never have to use, but it is there in those emergency situations. So this is just a general overview of the different levels of support that is offered through your behavioral health benefit, but I want to talk about how do you know if you're actually eligible for these services? So to determine eligibility, it's actually pretty simple. Eligibility for the services depends on the specific benefit plan in which you are enrolled. So if you're not sure if the plan you've chosen for your plan year covers your behavioral health benefits or not through MHC, you can determine your eligibility by contacting either MHC or your health and welfare fund directly. And the number to access MHC at is 1-800-255-3081 at extension 1, and that's going to connect you with our clinical team. Now, if you were going to contact your health and welfare fund, you can call them directly at 610-941-9400. And if you call either number, we're going to walk you through determining what services you are eligible for under your plan for yourself or your covered dependents. Once we've determined that you are eligible for services, it's important to know how to access them, right? How do you get connected with resources when you need them the most? So you can do that by making a call to MHC. And again, that's the same number I just provided, the 1-800-255-3081, and pressing option 1 to connect with our clinical department. And again, when at that extension, you're going to be greeted by a licensed clinician, an actual behavioral health provider. I myself as a licensed marriage and family therapist. We have licensed professional counselors on staff here as well. And we're going to lead you through the process of determining your needs, explaining your benefits, and helping to develop a support plan that's really going to help meet you where you're at. And in this process, we're also going to talk to you and help you coordinate and connect with a provider, right? And we'll match individuals based on your specific requests and needs. So maybe you have a specific specialty that you're looking to connect up with a provider around, such as depression or anxiety or grief and loss. Maybe it's a modality of therapy that you specifically want to connect with, such as couples counseling or group therapy. Or maybe you have your schedule's tight and you need a provider that can see you in the evenings or on Saturdays or Sundays. We're going to talk with you about all of that so that we can help match you to a provider that's going to work for you. And we understand that when you make that first call, when you connect with a provider, it doesn't always mean that your problems are going to be resolved immediately, right? We're ever evolving. Our needs constantly change. So if you're connected with a provider and you're thinking, I need more support, or maybe I need a different type of support, MHC is here to provide ongoing case management services to you and your loved ones. We want to make sure that you can live the happiest, most productive life possible. In addition to accessing support in your behavioral health benefit by calling MHC, you can also do so by visiting our website. Our website is mhconsultants.com. And here you're able to search for in-network outpatient providers, or you're able to request additional information from our clinical department by using the Contact Us tab. And this sends an email directly to our clinical team that we're going to respond to during business hours. Now, if you want to search for a provider online, right, you're like, I'm just curious about who's in my network or how many providers are in my area, or if anybody deals with this specialty, you can go to our website, and on the home page in the bottom left-hand corner, you're going to see a yellow rectangle, and it has a provider search feature. So there you're able to search for in-network providers and to learn more about who might be in your area that you can connect with for support. Like I said earlier, if you or your loved one needs support after hours or over the weekend, someone is always available. We have around-the-clock support for you and your family members during mental health emergencies. So if you needed to connect with our on-call clinician, you're able to do that by using our emergency line, which is 1-800-255-3081, and you're going to press option 6, and that's going to connect you with our on-call clinician after hours or over the weekend. I now would like to talk to you about your benefit coverage for the different levels of care covered under your plan. And mental health services are very similar to medical services, that they offer a full continuum of care, from outpatient services all the way up to inpatient hospitalization services. So we're going to start at the lowest level of care, which is outpatient services. And here, this is the level of care where individuals connect for individual group or family or couples counseling services. And that can be with a licensed social worker, a licensed professional counselor, a marriage and family therapist like myself, or even a psychologist. In addition to therapy services that are offered on the outpatient basis, medication management services with a psychiatrist or a psychiatric nurse practitioner are also available. And these services right now are being offered in person and via telehealth. Your coverage for outpatient services is pretty simple. that you do not have a deductible for in-network outpatient services, and you just have a $10 copay per appointment. Now, if you would connect with a provider that is out of network, your financial responsibility does include a $100 deductible per person, and then your services are covered at 75% of the allowable rate once that deductible has been met. Now, an allowable rate is unique, right? It's not actually the rate that the provider is billing for. It's a capped fee schedule for all out-of-network services. So you would be responsible for the remaining 25% and any balance billing. If you would ever have questions about what your financial responsibility looks like for out-of-network services, you're always more than welcome to contact NHC, and we'll help walk you through that so that you have a really clear understanding of what that bill could look like for your services. Now, as we continue along the continuum of care, the next two levels of care are both considered day programs. They're intensive outpatient services and partial hospitalization services. These are available for individuals seeking support around mental health concerns as well as substance abuse concerns. An IOP is the lower of the two levels of care, and that is typically 3 to 4 days a week for 3 hours a day. And then a partial is a little more intensive, a little more structured. A partial hospitalization service program is 5 days a week, and it's typically about 6 hours per day. And these are really utilized for individuals in which therapy once a week or twice a week just wasn't enough. They needed more support. Or if an individual is transitioning out of a hospitalization-based program and they need to step down to a less intensive level of care, but aren't quite ready to go to therapy just once a week. These services offer a combination of individual and group therapy as well as medication management services. And they both do require prior authorization by the program that you're connected with. And that's something that the program is responsible in securing at the time of your admission into their services. These services are covered the same way. So for in-network, you would have no deductible, and you're actually covered at 100% of the contracted rate. So it's really good. There's no financial responsibility for you or your loved one to seek that level of care. For out-of-network services, for intensive outpatient services and partial hospitalization services, you are again going to have your $100 deductible per person, but then you're covered at 75% of that allowable rate once that deductible has been met. Again, you would be responsible for the 25% coinsurance as well as any balance billing by the provider. Now, the highest level of care is inpatient care, okay? And this is care offered in a hospital-based setting or facility-based setting. And it's care, 24-hour care for stabilization of acute behavioral health and substance abuse concerns. And authorization of services for this level of care is based, again, on medical necessity. And the admitting facility really would request pre-certification of services with MHC's team upon your admission or your family member's admission. For your benefit coverage, there's no deductible for in-network inpatient services. You're covered at 100% of the cost again. For out-of-network, there is a deductible of $100 per person, and then you're covered at 75% of the allowable rate once that deductible has been met, and you're responsible for the remaining 25% in the balance billing. Now, I know that this is a lot of information. We don't expect you to memorize it. We're here to guide you along the way and to provide this education about how your coverage works at any time that you might need it. But it's really important to just discuss your benefits and help educate you around them, because given the year that we've all just lived through, right? A year that has experienced high levels of uncertainty, right? it's important to understand what happens to each of us when we're faced with sustained acute stress. At a certain point, the stress that was once helpful to us, that fueled us, that helped us be productive, may now actually be exhausting our minds and our bodies, right? We're only able to resist stress for so long before it starts impacting our physical and mental health. Now, we all respond to stress differently, but I just want you to know that it's important to recognize that maybe you or maybe your family members are experiencing increased levels of stress and anxiety right now. Maybe changes in your sleep habits or difficulty concentrating or increased levels of worry, right? You might be turning to substances or alcohol to help reduce some of those feelings that you're experiencing. Most importantly, I just want you to know that if you or your family member is struggling, if there was ever a time to understand how to utilize, explore your benefits further, now really is that time. And while the pandemic has created many obstacles for all of us, it's also helped to normalize mental health challenges and to reduce the stigma around accessing help. I think we can all agree that we've experienced some level of discomfort over the last year. But the pandemic has really helped create a shift that has brought about safer and more timely access to services through the use of telehealth. And I know I mentioned telehealth services earlier, but I want to touch on them briefly here. So despite being thrusted into the world of telehealth because of COVID-19, the members and dependents that we work with and support have found many benefits to telehealth services, right? Including being able to access support when, where, and how it works best for them. Right? There's a level of convenience here. It saves time from traveling to or from appointments, or it's easier to squeeze an appointment in on your lunch break or right before or right after work without having to take off. And many individuals are finding telehealth services to be just as helpful, just as effective as in-person treatment. So if you were having concerns regarding accessing treatment, telehealth provides a safe alternative to accessing support to the traditional in-person services that were previously relied on. And with that, regardless of what you or your loved one may be going through, we want you to know that you don't have to go it alone. Your Health and Welfare Fund and the team in NHC are here to provide confidential support around the clock to help you have your needs met. I know that we're recording this webinar today, so if you would like to be able to access it in the future, there is a link that is going to be shared and posted to the YouTube channel for the Health and Welfare Fund. But what I'd like to do is be able to open the floor and really answer any questions that anybody might have this evening so that I can really help you understand your benefit to the fullest. So I'm going to turn off my screen share so that I can be larger on your screen. And then Kelly, if there are any questions that I might be able to answer for participants, I can gladly do that now.
Sure. So it does look like we have a couple coming in. The first which is, what if I'm not sure what type of support I need?
That's a really good question, right? Oftentimes we might be feeling off, right? We know we're not feeling ourselves. We're feeling a little more overwhelmed or stressed. But maybe we're not really sure if we need a therapist or a psychiatrist or something even more intensive. That's really where our clinical team comes into play, where we're going to guide you from that first point of contact and talking to you about your needs, talking to you about the symptoms that you've been experiencing, and then talking to you and educating you about the different levels of care that might be the best fit for you. So don't feel like you have to know what you're requesting when you call in. Again, our clinicians are going to guide you through that process.
Great, thanks, Morgan. We do have a couple more here.
No problem.
The next one in is, what if I'm already seeing someone for therapy, but think I need more help?
Not a problem. So that's also a really great question. Sometimes you're connected to an outpatient therapist and the work you're doing is great, right? But you're still feeling like maybe you need additional adjunctive services. There are supports like group therapy out there, or even medication management services, or maybe it's an opportunity for us to speak with you and speak with your provider about, are you getting your needs met at this level of care? Or do we need to explore stepping you up to a more structured day program like intensive outpatient services or partial hospitalization services? So there's always additional resources out there that we can help guide you to and connect you with.
Great, thanks, Morgan. Next question. Is there a maximum number of sessions that I can have a year?
We get this question a lot. It might be one of the number one questions when we're explaining benefits to individuals. So no, there is no limit on the number of sessions you have per plan year or per lifetime on your policy. Treatment is always based on medical necessity. So this is something where your clinical provider would be reaching out to MHC to say, hey, I need to see this member once a week or maybe twice a week, but there's no cap. It's always based on medical necessity or medical need and specific to you as an individual.
Great, thank you. Next question. What kind of services are offered via the telehealth?
Yeah, so traditionally, prior to COVID-19, it was just outpatient services that were offered via telehealth. So either individual or family therapy with an outpatient practitioner, therapist, or even medication management services. Since COVID-19, telehealth services have become more widely used for all three of the lower levels of care. So that includes outpatient services, so therapy and medication management. It includes intensive outpatient services, and even partial hospitalization services are now offered via telehealth platforms. And a lot of programs are giving clients the option, right? Do they want to come in person? Do they feel comfortable enough coming in person? Or would they feel safer accessing that support via telehealth?
Great, looks like we have one more for now. If I want to see a therapist that's not covered, how do I get reimbursed for that?
Okay, so if you are going to see an out-of-network provider, I know when I was talking about allowable rates, right, it can get really confusing, right? What does that mean? How much am I going to have to pay? You are able to submit receipts for reimbursement of those services. What I would instruct you to do is make sure you're contacting MHC so we can walk you through it, right? We want to help you figure out the math of what you're going to owe. And what you do need is there are certain items on what we would call a super bill provided by your out-of-network provider that have to be included when it's submitted over to MHC so that you can seek reimbursement. But if it shows that you paid out of pocket to a licensed provider up front and you submit the appropriate documentation over to MHC, then your health and welfare fund, when that claim is processed, that receipt is processed, is going to submit reimbursement back to your member.
All right, well, that looks like all the questions that we've received so far tonight. If anyone does have any questions following this session, please do feel free to reach out to either MHC or the fund office. You can call the fund office at 610-941-9400. And the 1-800 number for MHC. Morgan, if one more time.
Yes, it's 1-800-255-3081. And to reach the clinical team, it's option 1. And if you're experiencing a clinical emergency, it's option 6 for our on-call clinician.